This is Dan from Pain Free You. Today's topic is going to be clarity is the antidote. So, it's raining, has been all day. You take a couple of nice deep breaths. I don't know if you noticed, but things are a little bit different here. Usually I have bookshelves back there, but there's a big hole in the wall, and you see all the ductwork back there? It's pretty crazy. Those bookshelves were literally inserted into the wall. And tomorrow, my landlord's got the HVAC company coming in to literally replace the furnace that's right behind the wall directly behind me. And they had to use this hole to go in and get it because there's no other way that gives them access that's big enough to move the old furnace out and put the new one in back behind the wall. So that's been fun, kind of pulling that apart. Got a whole stack of books there and a bunch of books, I don't know, back behind the bookshelf on the chair and all that. It's been fun. Let's take a couple of nice deep breaths. Breathe in the peace. Exhale the stress. Breathe in the clarity. Exhale the uncertainty. Breathe in something positive that you want. And exhale the negative. So, I'm talking about here clarity and how it's the antidote. Well, what is the antidote for? For toxic information, for toxic thinking, for toxic people and ideas, right? So let's talk about the toxicity first. You know, we start having symptoms, and the first thing we think is go to the doctor. Let's get this figured out. And we get medicalized, and doctors will give us this diagnosis. Another person will give us that diagnosis. We go online and we start reading all sorts of ideas and hunches as to what could possibly be causing the symptoms that we're dealing with. And so, Googling symptoms oftentimes results in just a lot more fear and confusion. And, anybody who knows about this mind-body stuff, the mind-body syndrome, TMS, knows that Dr. Sarno pointed out that structure most often, is not the cause of the pain. TMS is, which is this, in my opinion, nervous system overload from a lifetime of learning to become more and more vigilant, hypersensitive, to the point where not all, but many of our physical sensations are perceived as dangerous and therefore felt as pain. You combine that with other dangers like emotions, work stress, home stress, mental stress, thinking stress, and then the medicalization of being told that you're broken. Then you go into some of the Facebook groups and the online forums. And man, some of those places are extremely toxic. Even some of the TMS ones, the mind-body ones. There's still a ton of people talking symptom, and really vomiting all of their fear into the group. And so one post in those groups can trigger hundreds, if not thousands of people. First of all, that's why my group, I'm the only one allowed to post, because I really want the group to be a positive place, non-triggering, and a place for solutions and optimism and success, as opposed to people in their worst state just literally sharing, and triggering all sorts of other people. So there's a lot of toxicity out there, from online research to online forums and groups. Even family members unwittingly will say things like, you've been playing with this mind-body stuff for a while. Just go to another doctor. Find somebody. They got to be able to fix you. Or take this medicine. Or you should have this treatment because that works for my Aunt Bertha. And. And all of these various opinions, and I will call them opinions because that's what they are, about what is wrong with you, are just opinions. Number one, you do not have to take them seriously. You do not have to believe everybody's opinion as it relates to you. And so many times there are people who kind of come to me and they're in a pretty good worked up state of panic. And, inevitably as I get into conversation or messaging with them, they'll say, well, how do I know it's TMS? This one person said, this happened to them. And, how do I know that that's not happening to me too? And so oftentimes when we're in a state of fear, in a state of worry, in a state of hypervigilance, we're so concerned that something might be missed or we might be assuming it's TMS when it's really not, it might be something else, that we'll believe almost anything that kind of says it's structural, it's physical. You might have a real problem. Somebody today was messaging me and they were told they had like 3 different potential or 4 different potential diagnoses regarding bladder, urinary, pelvic pain type of symptoms. And, there was no real consensus from the doctors as to what exactly was causing it. And to me, that's great news. Now, for many people, that causes a lot of fear because it's a lack of certainty, it's a lack of clarity, because nobody can kind of figure out what it is. But to me, what that means is it's even more evidence that this mind-body syndrome, the pain is created in the brain, is what's going on. Because, look, doctors are pretty good at telling you what's wrong with you and what's broken. And if they're not coming up with anything or nobody can agree on it, it's because they don't understand the mind-body connection. They don't understand the concept of learned pain or learned symptoms, neuroplastic pain or neuroplastic symptoms that have become memorized or learned by the brain. And so clarity is the antidote. So what do I mean by that? I literally mean that if all of this uncertainty, all of these toxic people in your life, sometimes it could even be a spouse, it could even be family members, anybody who's kind of dismissing this whole mind-body stuff and telling you to go see a doctor and bringing it up and asking you 18 times a day, how you doing? You should really go see a doctor. Number one, as it relates to those type of people, if they're in your life, you can coach them. You can lovingly say, I know you care for me and you just want to see me get better, but let's do ourselves a favor, both of us. Let's not talk about my symptoms, because talking about them just keeps them present. And what does the brain do with the things we think about and focus on most often? It wires them, keeps them persistent. Fear plus attention are the 2 things that make a one-time pain persistent or chronic. So talking about your pain all the time is not the answer. Researching it for 18 hours a day is not the answer, because all you're doing is using those neural pathways that are firing these signals, these sensations. So clarity is the antidote for the toxicity. When you have clarity, that comes from really deeply understanding what is going on, what this mind-body syndrome is, how it works, how the brain works, how pain works, how neuroplasticity, how brain wiring works, what kind of takes pain and makes it chronic. I just told you, fear plus attention. When you truly understand that, you can start to look at your own situation. You can look for examples. You can take the assessments, ppdassociation.org/symptoms. Grab a pen, write that down, ppdassociation.org/symptoms. You can go to my pain test, yourpaintest.com. And, those tests are based on some personality types. The PPD stuff really includes some past traumas, but definitely pain behavior. How is your pain behaving? Because this mind-body stuff kind of behaves differently than something like a true injury, right? or a true structural problem. And I'll be honest with you, I've been dealing with this stuff for 24 years, and I've almost never find people who say, well, Dan, I was dealing with the TMS stuff, and come to find out it was really a fracture, or it was really this, or really that. Inevitably, it's almost always TMS. So if you've done the assessments, you've connected the dots, there was no true car accident or traumatic body trauma, and pain came about. Maybe you bent over, maybe it felt like an injury. But inevitably, if there was nothing traumatic, you didn't fall off the roof of your house, but you just started developing pain and then it became persistent, it's almost always TMS. Not that I'm saying everything is. I'm not saying structural problems cannot happen, but most things are. TMS, mind-body. Clarity really helps, because when you're clear on it, you can dismiss these nervous Nelly thoughts, these fearful thoughts. I go, but what if it's this? I'm hurting really bad today. Maybe it is structural. No. If you didn't do anything, you didn't fall out of bed or out of a tree, and you're hurting more today than you were yesterday, structure doesn't do that. It doesn't make sense. TMS can do that, for sure. But look, clarity will help you hear from these people in your lives, whether it be coworkers, family members, spouses, kids, parents, you name it, and they start questioning this whole mind-body stuff. When you have clarity on what the cause of your symptoms are, you can let the things that you're hearing from these people, and even doctors or chiropractors or physical therapists, and you can let that stuff roll off of you. And by the way, if you're still going to practitioners to treat your body, your brain's not going to buy into the TMS mind-body concept. Why? Because you're treating your physical body, and all your brain sees from that is confusion that goes, must be the body. Why else would they go to physical therapy? Why else would they go to a chiropractor? Why else would they use an ice pack or heat pack? They're trying to fix the body. So look, if you're treating the body, the brain's not going to be convinced when you say it's TMS. That's Dr. Sarno, TMS 101, first day of class. Stop physical treatments. Look, if there's pain meds that help you get by and help you focus on this mind-body approach, by all means, be kind to yourself. Don't judge yourself harshly for that. It's a little bit of a gray area because people can argue, well, isn't that a physical treatment? Yes and no. Anyway, we don't have to get into a whole medication discussion, but my point is, get clear on what is causing your symptoms so you can get clear on what approach you're going to take. And my recommendation is always going to be the TMS approach. And even if you're really uncertain, if you're on the fence a little bit and you're like, I'm like 90% TMS, but got 10%, and maybe you've heard people say, you need 100% belief or you're never going to get better. I don't think that's the case. Let's start working to teach the brain with the clarity of thought, clarity of what is causing the symptoms, to be the antidote and kind of make the toxic thoughts, groups, things you've read in the past, things doctors have said in the past. When you have clarity, those things that you've heard and read in the past become less significant because you can much more easily discard that as not true for you. So clarity is definitely the antidote. It will get you on the straight and narrow and keep you on the path. Because every time you jump off the path and start thinking and treating physically, you're confusing yourself. You're confusing your brain. Your brain wants to believe it's keeping you safe. But if you keep going back and forth, it's not going to know what to believe. So clarity is a really good first start. Accurate knowledge. Learn about TMS. Do the assessments. Really nail this down for yourself and make a decision. And yes, it is a decision What's causing the symptoms? Once you decide it's TMS, don't look back. The jury's reached a verdict. Case closed. Investigation is complete. Decide and stay the course. Because again, every time you flip-flop back, you got a bad day, and all of a sudden you're in a panic and going, oh my God, it must be physical. No, that's not proof of anything. It just means you got a bad day. And if you remember, I've talked about how pain is a warning signal saying, the brain perceives danger. Well, any type of danger can cause a flare-up. Doesn't have to be a physical movement, doesn't have to be an injury. If your pain's just worse today than it was yesterday, there might be some kind of a perceived danger that caused it to spike. The best way to respond is calmly. It's no big deal. I know it's mind-body. I know it's TMS. And that clarity is the antidote for the toxic thoughts and the fear, frankly. Because when you're clear on it, it's easier to reassure yourself that you're okay. So I hope this makes sense. Get clear. If you need help in getting clear, I do have a course, and it maps out all of the things that I talk about on a daily basis, but it puts it together in one place. And then, if you need more clarity, guess what? The course comes along with weekly group coaching calls, Q&A calls, where you get to ask your questions, and kind of we talk as a community about these things and help people gain more and more clarity, because when they get that clarity, their fear starts to drop. And I'm seeing some fantastic stuff with these group members. So if you're interested in that, go to painfreeyou.com/join, or just go to painfreeyou.com and look for the course/group coaching option on the top menu. There is a video on the homepage of painfreeyou.com, and that gives you a really good understanding and clarity as to how this mind-body stuff works. But if you really want to kind of fast-track your results, and you've been kind of floundering for a while, even if you've been watching my daily videos, but you still feel like I'm not making progress, jump into the group, even if it's just for a month or two, right? There's no start and stop. Many people can get what they need and gain the clarity they're seeking in a 1-month membership. And that's even less money than it is to hire me once for a one-on-one coaching call. So, clarity, it's really important. Get clear on your situation so that you can use that as the antidote for uncertainty, for doubt, for fear, and toxic information from the web and other people. So, love you guys and gals. I'm going to wrap this one up, and I will see you tomorrow. Wish me luck on the furnace install tomorrow. Hopefully it's a one-day job. I had to take Finn and bring him to my son's house because I don't want my cat here to be terrorized by these guys coming in here and ripping the place apart and doing all that work. So, no Finn tonight. Sorry. We'll see you tomorrow. Love you.